we're going to see the maneuvers that are done in physical examination in regarding to a patient that we suspect that has some disease, usually a fracture or a rupture of a tendon or something like that. Here we're going to see the test for the tendinitis or rupture of the biceps tendon, the acromial impingement syndrome, rotator cuff tear, and could be the shoulder dislocation. So first, for biceps tendinitis, we have Gerson test and Spitz test. Here we have the shoulder flexed at a 90-degree angle. In Gerson test, the arm is also in pronation, and the physician will put a force in order that the patient does supination with resistance. And in the Spitz test, the shoulder is flexed at a 90-degree angle, the elbow is extended, the arm and forearm are in supination, and then there will be a force that the patient needs to overcome and try to flex the elbow. If any one of these tests produces pain, it is just tendinitis. If it produces pain and inability, it is the tendon rupture. This could be diagnosed with a MRI or a ultrasound. Next, for the acromial impingement syndrome, this is usually a tendon of the rotator cuff that is being in pain. This could lead later to a tear of the tendons of the rotator cuff. So first, for the impingement syndrome, the patient has pain with abduction, usually. This is performed by the supraspinatus muscle, the first 15-degree angles of abduction. Here we have two tests. One is Neer's test and the other is Hawkins-Kennedy test. In Neer's test, the patient has all the arm extended, and the physician will try to bring the arm doing flexion and internal rotation. So it is like the arm is coming to the ear. And the other hand of the physician usually will be here on the scapula in order to neutralize those movements. Again, just pain. It could be just inflammation, pain, and inability is the impingement syndrome, or the impingement syndrome, and the other is Hawkins-Kennedy test. That is, the shoulder and elbow are flexed at 90-degree angles. We will do internal rotation of the arm that leads to pronation of the elbow. If this is painful, it's a positive test. And also the physician needs to stabilize the scapula. So one of the hands of the physician will be there. And for the rotator cuff tear, we have the drop arm test. That is, the patient will abduce the arm between 60 and 180-degree angles, then need to gradually return it to the neutral position. When the patient has a tear of the rotator cuff, the arm will drop instead of returning slowly. And the other is the empty can test. That is, the patient will do abduction of the arm, the internal rotation like the thumb pointing down, and then the physician will put some force here, and the patient needs to continue abducting the arm. If this produces pain, or if the patient is unable to perform this test, this suggests the rotator cuff tear, usually the supraspinatus muscle.